Hey guys, we are looking at the muscular system this time. In general, we're going to look at different types of muscles in your body and different muscles throughout your body. There's a lot, but we will only focus on the main ones. And the very, very important question, which will be on your exam as an essay question, is how exactly can your muscles contract and relax? In this video, first we will focus on different types of muscles as a review and look at major muscles on your body. And then in the next video, we will finish this chapter with answering the questions, how do muscles contract and relax? As a review from the tissues section, we have three different types of muscles: skeletal, cardiac, and smooth muscles. Skeletal muscles is about this chapter. We look at skeletal muscles and how it help us contract our muscles and generate movement. Cardiac muscles, we will zoom in during cardiovascular chapter. And smooth muscles, there's a lot of organs that have have smooth muscles. We have organs of the digestive system. We have blood vessels as well. So they're kind of spread out. There's no specific chapter we focus on that, but we will see them again and again. But in general, skeletal muscles have a lot of striations. We will look at what give these skeletal muscles these stripes in just a bit. Skeletal muscles will always attach to bones, and that's how you move. When these skeletal muscles contract, they will pull onto bone because they attach to bone, and that's what generates the movement. Bones itself don't help you move. Muscles itself don't help you move. Together, muscles and bones can generate movement and help you move around. Special characteristics of skeletal muscles include they have cylindrical shapes, so they're pretty long. They have multiple nuclei, considering as multinucleated. And of course, skeletal muscles are voluntary because you totally have full control over which part of the body you want to contract. For example, you want to raise your hands, you want to stand up, you want to walk around, you have full power. You can tell your muscles when to move. In comparison to cardiac muscles, these are muscles that line the wall of the heart. They also do have striations, but they don't have as much nuclei. They're often single nucleated or uninucleated. They only have one single nuclei. Once in a while, you find there may be two, but it's not one of the common case. So they still technically consider as uninucleated. They do have striations because their functional unit of contraction is very similar to skeletal muscles, just slight difference, with slight differences, but still work in similar way. One other special characteristics of cardiac muscles is that the muscle cell itself branch out, and they have these intercalated discs here that help cardiac muscle cells to communicate with each other so that they all can contract at once. It's kind of weird to have, a piece of your heart contract and another piece of your heart contract and another piece of your heart contract, right? You're not going to be able to pump out blood as effectively. The other type of muscles that we have is smooth muscles. Smooth muscles are involuntary, just like cardiac muscles do. Just think about it. You don't tell your heart to when to contract, and you don't tell your stomach to digest food, right? They just happen, involuntary. You don't have control over it. Smooth muscles characteristics are slightly different from the other types of muscles. They are spindle shape. That means the ends of the smooth muscles is very pointy. That's why they call them spindle shape. And they don't have striations at all. That's why they're considered as smooth. they are nucleated. They only have one nucleus for every cell, unlike skeletal muscles, which have many nuclei. Here are the 4 main characteristics of a muscle. If a tissue have these characteristics, they are considered as a muscle tissue. One of the characteristics is that it needs to be excitability. That means when a neuron trigger it's to contract, that tissue needs to be responsive to that signal or the stimuli that's sent by a neuron. The other characteristics is that they need to be contractible. Contractibility refers to that tissue being able to shorten in length when the neurons tell it to contract. And extensibility means that tissue, when it's shortened by contractibility, it needs to be able to stretch out again. And the last characteristics reflect back to contractibility and extensibility. In order to be able to contract and extend, it requires elasticity, or that ability that it's to stretch and recoil back to its original length. So why do we need our muscles for? Well, of course, we need our muscles to pull on our bones so that we can move around, right? So muscles can produce movement by pulling on bones that they attach to and make our skeletal move. The other function of muscles is that it helps our body maintain posture and body position. That means you can sit in one spot without flipping over. It's because you can maintain your posture. Some of your muscles are in constant contraction phase to keep your body upright. For example, when you sit in class, or you're just sitting and watching my lecture, you're not just flipping back and forth, because those muscles are constantly contracting to hold your body up. Your muscles can also help with stabilizing your joints, so that they can stay in place. Without enough support, your joint wouldn't be able to stabilize and connect bones to bones. Instead of being one full skeleton, you would just be pieces of bones, pretty much. And of course, we talked about this function previously, that muscles can generate heat as they contract to maintain your body temperature. Now, let's start looking at some of the muscles in our body. There's a lot, obviously, but I select out some of the more obvious and important ones for this class. First, let's look at muscles of your face. Okay, so with muscles of your face, these muscles are also considered to be muscles of facial expression, because with these muscles, they help you make faces. Could be a sad face, a funny face, a happy face, whatever that face is. You use these muscles to make faces. So one of the more obvious muscle is your frontalis, right? Let's just write it down. Frontalis. With the frontalis, well, guess where you got the name? You got the frontal region. You got the frontal bone. So what is that muscle? The frontalis, obviously, right? With the frontalis, when they contract, as you can see, the muscles will shorten and pull up your eyebrows. So with frontalis, it will help you basically elevate your eyebrows. Another muscle here on the face, one of the more obvious muscles, muscles of your eye, right? Wrapping around your eye. This muscle is the orbicularis oculi. Remember, the ocular region is the eye. So orbicularis means it's in an orbital, it's circular, it's round. That's what orbicularis means. So we have orbicularis oculi, because oculi for ocular. Another very similar name muscle, we have muscles of the mouth, surrounding the mouth, right? So this muscle here, it's round because it's going around the mouth. So it's orbicularis again, but it's actually oris, because for the term oral, oris, right? So just imagine the muscle fibers here. When they contract, the orbicularis oculi is going to help you close your eyes. You use this muscle when you need to shut your eyes closed. In terms of the orbicularis oris, just think about you trying to kiss someone, where you stick out your lips, right? You kind of like make it round up and stick it out. That's because of the orbicularis contract and make that kissy face. Another muscle here, we have the buccinators. So this guy right here, that's the buccinator. It's basically the muscles of your cheeks. Have you tried to suck in your cheek and kind of like try sucking on something? If you suck on something, you have to use these muscles and compress your cheeks and make it go inward. That's the buccinator. I mean, you use these muscles on your face to make facial expressions and make funny faces, but you also need these muscles to eat, right? Because you need to move your jaw. So one of the joints on your body that is movable from our last lecture, remember what that is? It's the TMJ, right? Temporomandibular joint, between the mandible and the temporal bone. How do you chew things? You need to drop your mouth and you need to pull it up, right? So in terms of pulling up your mouth, you have this muscle here, this big muscle right here, called the masseter. This masseter, along with this muscle right here, it's called the temporalis, because it's on the temporal bone, right? That's why I tell you to learn the bones, otherwise you're gonna have trouble with the muscles. With the temporalis and the masseter, they help you elevate your jaw and help you like bite things. With the buccinator helps, you can compress the food and move the food around with your tongue, which also is a muscle, FYI. Some other very easy muscles that we have here. You see this muscle on the you see this other muscle on the nose here? Well, what do we call the nose? Nasal, right? How do you make it fancy? Nasalis. That's it. Nasalis is the muscles on your nose. And these muscles, when they contract, they're going to pull up your nostrils. Try it. It's actually kind of weird. Anyways, the other muscle that is really easy is this muscle right here on the back around your occipital region. What do you call that? Occipitalis. It's not that bad. It's just really make name bones really fancy. Okay, so those are some of the muscles that I want to show you on the face. Some other ones you can learn in other class. Now let's look at the muscles of the neck, muscles that help you move your neck. We have several muscles, but I'm just gonna point out once again the big ones. So we have the sternocleidomastoid muscles here. It's actually both of these guys here together as one sternocleidomastoid, and of course you have them both on both sides. In this picture you can also see it's this group right there. That's the sternocleidomastoid. So how do you think people got the name sternocleidomastoid? Well, because it attaches to the sternum. That's where we got the sternal. Cleido, because it attaches to the clavicle. And mastoid, because it attaches to the mastoid process, which is the bony piece that you felt behind your ear. So we just combine them together. Sternocleidomastoid. Fancy, but it's not. With this muscle, what you can do with it is flex your neck to the side. So lateral flexion of your neck. Flex it to the side. So the left sternocleidomastoid will help you flex it to the left, and the right sternocleidomastoid will help you flex to the right. The other really cool muscle is this muscle right here called the platysma. It's kind of like a drapes that drapes over all other deeper muscles. Like the sternocleidomastoid is also under that platysma. And what can this platysma do for you? This face. Isn't it funny? So you can try it. So kind of like just tense up your neck, and when it contracts, you're gonna see this face. That's when the platysma is contracting. Moving down to the muscles of your trunk, specifically the muscles of your abdominal wall. So with the abdominal wall, you have very popular muscle here called the rectus abdominis. Rectus, from the Latin word, you learn that it means straight. So this is one straight muscle down, and it's on the abdominal region, so it's the rectus abdominis. This muscle is pretty much your abs muscle. You see guys with abs, or women with really good abs. You can see these packs here. Those are the packs that we consider, or that's what we consider as six packs kind of thing. Those are the rectus abdominis. These muscles here will help you flex your trunk, so bent down pretty much. And you also have these abdominis, oblique muscles on the wall of your abdominal as well. There's 3 different layers of that. You have the external oblique, because it goes obliquely like that, and it's on the most external side, the most superficial of the 3 muscles, so it's called the external oblique. You can just pretend like you put your hands in your pocket. That's direction of the muscle fibers. And then the middle layer goes in opposite direction. That is the internal oblique muscle. And then the very inside of that is going transversely on the transverse plane. So we call that the transversus abdominis. With the external and internal oblique, it helps you rotate your trunk. Versus the transversus abdominis is going to help you compress your trunk. Have you tried sucking in your belly really, really bad? Like suck it in, suck it in. When you use the transverse abdominis muscle, it's gonna help you suck in your belly. Have you ever tried to scream? Or during defecation, or go number 2, and then you like really, really push? That's because of that guy. The transversus abdominis is help you compress your abdominal cavity. Screaming, vomiting, childbirthing, anything pushing related also uses the transverse abdominis. Have you tried screaming? Try to scream. You're gonna feel that your abdomen is sucked in. That's because of the transversus abdominis. Cool, right? Now let's look at muscles of your thoracic cavity that help you breathe. muscles of respiration or breathing muscles. We have these intercostalis muscles, as the name suggests. Inter means in between, and costalis means these ribs here. So intercostalis muscles means muscles that are in between the ribs. There are external and internal, but you don't have to know that. You just have to know that the muscles in between the ribs are the intercostalis muscles, that when they contract, they are going to help you increase or elevate your thoracic cage, to increase the size, to draw air in. Basically help you breathing. The other very, very important muscle that help you breathe is the diaphragm, which is this guy here. It's kind of like a sheet that separates your thoracic cavity and the abdominal cavity. It's actually is a muscle. It's very thin but extremely important muscle that help you increase the thoracic size when it contracts to help you breathe. If any damage to this muscle can lead to immediate death. Interesting fact, I was going to tell you this when we get to the nervous system, but because we're looking at the diaphragm and I'm really excited, so I'm going to tell you now. With the diaphragm, there's this one nerve that innervates the diaphragm called the phrenic nerve, and sometimes the phrenic nerve could get irritated when it innervates the diaphragm. So what happens is that you get hiccups. That's why when you have hiccup for a long time, over 24 hours, it actually is a medical condition, because medical providers are actually concerned with you gonna be in trouble with breathing because something is wrong with the nerve that innervates your diaphragm. All right, so if you remember the pectoral girdle, right, that includes your scapula, your shoulder blades, and your clavicles, which are your collarbones. These pectoral girdles help attach the upper limbs or your arm to the axial skeleton. So they need to be stabilized, right? And they need to be positioned properly. Otherwise, your arms wouldn't be able to connect to the axial skeleton as well. So there are a few muscles that help stabilize the pectoral girdle to increase stability of the attachment between the upper limbs and the axial skeleton. With your chest muscle, your thoracic muscles, you have the pectoralis, right? So with the pectoralis, there's a major one, which is on the outside. And then deep inside of the pectoralis major, you have these pectoralis minor. We're going to talk about the pectoralis major in a bit. But the pectoralis minor is deep inside of that. And this is one of the muscles that help stabilize the pectoral girdle. As you can see here, it has attachment with the acromial ends of the scapula, and basically attaches that to the ribs. With this muscle, what it can do is that, so here's the muscle, right? So it would, when it contracts, it would shorten these fibers, and when it shorten, it's going to pull the scapula toward the front, what we consider as shoulder protraction. Protract your shoulder anteriorly. Some other muscles that stabilize the pectoral girdle locate on the back. So we have this big trapezius muscle here. It's actually one of the biggest muscle in your body. It goes from the external occipital protuberance of your occipital region, attaches to the spinous process of the scapula here. It's the part that you feel on your back, right? And it goes all the way close to the lumbar region. Attaches to specifically T12, around T12 of your vertebrae. So it's pretty big, wide, and long at the same time. With these muscles, as you can see, the fibers goes in several directions. So it can go in that direction, or it can go in that direction, or it can go in this direction. With trapezius, because of the wide range of its fibers, it can do a lot of. So obviously, we can see that the trapezius here is a great stability for the scapula, which is your part of your pectoral girdle. But if you look at the fibers here, when it contracts, it pulls that way. So it makes your scapula goes backward. Other words, retraction of the shoulder posteriorly. And these fibers up here, when they contract, they're going to pull the fibers, or shorten the fibers inferiorly, shorten and go downward. So that means it will pull the head down that way, extending the head. These fibers down here also help with shoulder extension. These can also help elevate the shoulder as well. So because these fibers are kind of going upward, so when they're shortened, they can elevate the shoulder. Another muscle that can act on the shoulder or the scapula is this muscle right here, the levator scapulae. Levator means you're pulling something up, you're levitating something, and scapula is your scapula. So it's levator scapulae is the muscle that elevate your scapula, elevate your shoulder elevation, basically. These muscles right here also attaches to the pectoral girdle and stabilize it. You have rhomboids major. So here's rhomboid major, and here's the rhomboid minor. Minor because it's smaller, and major because it's smaller. These muscles are actually deep within the trapezius. It's under the trapezius. You know, when you massage someone, you actually try to massage those muscles right there. And what happens is you try to massage in the direction of the fibers. It's more effective when you massage in the same direction as the fibers. I mean, technically you could massage any of these muscles, but if you understand how the fibers direction goes and how it affects movement, you can target the direction of the fibers, making the massage much more effective. Now let's take a look at some of the big muscles that move the arm. Obviously we have the deltoid, right? So with the deltoid, it's on the lateral aspect of your shoulder. And what it does is that when you contract its fibers and it gets shorter, it's going to help you abduct the arm, or abduct the arm, taking your arm away from your body. The other muscle that helps you move your arm is the latissimus dorsi here. That latissimus dorsi right there. With that muscle, it goes all the way and it attaches to the deltoid tuberosity part of the, well, you don't have to know that, but it's part of the humerus. So it goes up and attaches to the humerus, right? And so when these muscles contract, it's going to be shortened. And when that shortens, it's going to help you extend your shoulder. So bring your shoulder backward. The other muscle here, a very, very popular muscle, it's the pectoralis major. So inside was the pectoralis minor. The outside one is the pectoralis major. With the pectoralis major, if you look at this here, the muscles, when it contracts, it's going to bring inward like that, right? So that means it's going to help you adduct your arm. Adduct, bring it back in. It can also do one more thing, which is internally rotate your arm, internally rotate your shoulder inward, but it's not as strong as adducting the arm, bringing the arm in. There are many other muscles, but obviously we are not looking at them all. There are some other muscles that support the shoulder and help the shoulder a little bit more flexible besides stabilizing the pectoral girdle. They're called the rotator cuff muscles. It's a circle of tendons. It wraps around the tendons around the shoulder joint, helping with stability as well as increasing flexibility of the shoulder. It can help the shoulder do a little bit more. It's called the rotator cuff group. There's several muscles in that rotator cuff groups, but we're not looking at the specific ones. With moving the arm, we also have a few more muscles here. We have the, well, it's not really moving the arm, more specifically moving the forearm because it attaches to the forearm bones, in this case the radius, and it helps flex the elbow instead. Those muscles include the biceps brachii. Biceps because it has two heads, so that's one head, here's another one head, and then they go down and they attaches to the radius bone right there. And so when these biceps brachii contract, it's going to help you flex the elbow. There's another muscle right under that. It's called the brachioradialis. It's the brachialis. It's the brachialis instead. It's under the biceps brachialis. So if you just pull up the biceps brachii, keep on messing it up. If you pull up the biceps brachii, you're going to see the brachialis right under it, and that's one of an even stronger muscles that help you flex the elbow. The brachioradialis here also helps you flex the elbow. So it starts from the humerus and it goes all the way and attaches to the distal aspect of the radius. And when it contracts, it's going to pull up, and that will help you flex the elbow. The other muscles on the back of the arm is this triceps brachii. It triceps because it has three heads. It has a medial head, a long head, and a short head. But it goes all the way down here and attaches to the forearm. And basically, when it contracts, it's going to help you extend your elbow. So it does the opposite of the biceps brachii. If you pay attention to all of the muscles that we talked about recently, any muscles that crosses the anterior aspect of a joint or the front of the joint, it always does some sort of flexion. And any muscle that goes in the opposite side of that muscle or toward the posterior aspect of a joint, it does extension. So this bicep brachii here, right, it passes the front of the elbow, so it does flexion. And this triceps brachii here, it span across the posterior aspect of the elbow joint, so it does extension. we're gonna see a lot of these themes. It's majority of the muscles in your body. If they pass the front, they're going to flex or bend your body part. And if they goes in the back, they're going to extend or does the opposite from the muscles that is in the front. Same thing with if you look at the muscles on your forearm. So muscle on the forearm right here, right? So you have the front muscles and you have the back muscles as well. These front muscles here, because they're on the front and they passes the wrist joint, so they're going to help you flex the wrist as well as the digits. Versus the muscles on the back of your forearm here, they would help you extend your wrist and extend your fingers instead. Here's a zoom in of some of the muscles on your forearm. So we say that here is the brachioradialis. Brachial because parts of it attaches to the brachium, specifically the humerus. And then it goes and attaches to the radius. That's why we call it the brachioradialis. And when it contracts, it's going to help you flex your elbow. The other muscle that I want to point out is this muscle right here. It's called the palmaris longus because it attaches to the palm and it's pretty long. So palmaris longus, this is a muscle with a long skinny tendon, which is that tendon right there. Right? With that tendon, it extends all the way toward the palm. Some people have this muscle and some people actually don't have this muscle. Actually, about 14% of the population lacks this muscle. They don't have this muscle. This is actually one of the vestigial muscles that our body doesn't exactly need. Back then, we need a lot of grip strength. Our ancestors are closer toward, living with trees and need to grab around, hang around. So they need a strong gripping aspect. So if you remember, I said muscles toward the front of the forearm here, passing the anterior aspect of the wrist joint, will help you flex your wrist, and then fingers helping with a strong grip. So you need a lot of those muscles. But because we don't exactly live on trees anymore and we don't like grip things as much anymore, this muscle becomes unnecessary. So we don't exactly have it for some people. To check if you have it, just do opposition. So your thumb touching your pinky and add a little pressure. You should see that a tendon pop up. That tendon is actually the this tendon right there. That tendon right there. It's the tendon of the palmaris longus muscle. And it's okay if you don't have it. It's totally normal. It doesn't affect your gripping potential by any chance. In fact, if you need muscle replacement, this is one of the muscle that doctors could potentially use as your graft, if that's ever come to that case. But bottom line is that not everyone have this muscle. But if you peel out all of these muscles, just peel it off, you should see another muscle right under that. This is called the flexor digitorum superficialis. It's got its name because it's on the flexor aspect of the forearm. It's on the anterior aspect. It helps with flexing. What is it flexing? It's flex the digits, digitorum. And it's superficial to another muscle called flexor digitorum profundus, which is a deep muscle, deeper to the superficialis. So the flexor digitorum here, it actually attaches to your digits 2 to 5. And what it does is that it flexes the hand as well as the digits and at the knuckles, which allows for a strong and rapid finger movement, such as like typing or or playing musical instruments. It's a very skillful muscle. Okay, now moving down to muscles of your thigh. Actually, just point out the muscles of the butt first. One muscle of your butt is the gluteus maximus. It's one of the big gluteal or butt muscle. This muscle can help you extend your hip and also help with lateral rotation of the hip as well. So that's the hip. There's more, of course, but once again, just know the gluteus maximus. If we move down toward the thigh, we have two main groups. We have the quadriceps group on the front of the thigh, the anterior region of the thigh, and then we have the hamstrings group toward the posterior aspect of the thigh. Generally, the muscles that crosses the anterior aspect of a joint would do flexion, and the muscles that passes the posterior aspect of a joint would do extension. But with the leg, it does the opposite because of the changes during developmental process. With the legs, muscles on the anterior aspect of a joint would do extension, and muscles on the back of the leg does flexion. This is only for the leg, but generally majority of the muscles of your head, muscles of your trunk, muscles of your arms, all of those have the general rule. Okay, let's take a look at some of these muscles here. So we have the quadriceps group on the front and the hamstring groups on the back. The quadriceps, quads mean four. That means with the quadriceps group, we have four muscles, right? So we have the rectus femoris here. With the rectus femoris, as the name suggests, rectus means straight. It's one straight muscles down, and it's on the femoral region. So we call that the rectus femoris. And then there are some vastus muscles on the side. We have the vastus lateralis, which is on the lateral side of the leg. And then we have the vastus medialis, which is on the medial aspect of the leg. There's one more muscle called the vastus intermedius, which is right under, deep to the rectus femoris. All those four muscles together is what we call the quadriceps group. And if you look at the pattern, if you look at the pattern of the muscle here, if the muscles contract, it's going to shorten these muscle fibers, and these muscle fibers, they all insert to the tibia, and when they contract, they're going to pull the knee joint up, so extend the knee joint, extension of the knee basically. In comparison to the hamstring group, which is on the posterior aspect of the thigh, they also attaches to toward the tibia, the lower leg bones, but because they are on the posterior aspect, they're going to flex the leg when they contract. With these muscles, with the hamstrings, we have two muscles. Well, specifically three. We have the bicep femoris here on the lateral aspect of the leg, of the thigh specifically, and then you have these two muscles called the semimembranosus, which is on the bottom here. That one right there is the semimembranosus, and then the one that goes right on top of that, that is the semitendinosus. And once again, both the biceps femoris and the semimembranosus and the semitendinosus, or the hamstring group, and they attaches to the the lower legs. When they contract, they're going to pull up the lower leg, leading to knee flexion. If you look at the leg on the lateral aspect of the thigh specifically, you see that the gluteus maximus extends down to form this white piece of membrane here, and goes all the way and attach the tibia. This is what we consider as the iliotibial tract, because it attaches from the ilium aspect all the way down to the tibia. That's why we call it's the iliotibial tract. Its whole function is to help stabilize the hip and the knee. Another muscle that's really cool, which is over here, it's a really long muscle called the sartorius. This muscle is one special muscle that can help you cross your leg. If you just all of a sudden remove this muscle, you will not be able to cross your leg. It can basically abduct your thigh, elevate it to put it on the other leg, leading to the action of crossing your legs. Here's another view of the muscles that we talked about on the thigh. So we have the quadriceps groups on the front here. We have the rectus femoris, it goes straight down, and then you have the vastus lateralis, vastus medialis, and vastus intermedius, which is deep to rectus femoris, and all of this forms the quadriceps. Quadriceps. And then on the back of the thigh, there's your hamstrings. You have the biceps femoris, the semitendinosus, and semimembranosus, and they're all function to help you flex your knee. And once again, here's the sartorius that goes all the way down. Let me just erase that so you can see it better. Right there, that's the sartorius, and that's the muscle that help you crisscross your legs. And here's the IT band that I was talking about earlier. It goes from the gluteus maximus all the way down to the tibia and help you stabilize the hip and the knee joint. Now let's go down a little bit and look at muscles of your lower leg that help you move your foot and your toe. With the lower leg, if you kind of trace down from your patellar, go down touching your tibia, which is your shin right here, right? So you touch that on the left of that muscle. Depends on which leg you're talking about, but toward the lateral aspect of the leg, you're gonna find or feel that tibialis anterior. Tibialis, because it attaches or next to the tibia here, and it's on the front, tibialis anterior, and it's one of the muscles that help you it's one of the muscle that helps you dorsiflex your foot, dorsiflexion of the foot. If you look on the posterior aspect of the leg, you're going to see the gastrocnemius. So basically your calf muscle, if you touch your calf, you're gonna feel the gastrocnemius. These gastrocnemius here attaches to the calcaneus bone via that calcaneal tendon. Right under the gastrocnemius, you're going to have what we consider as the soleus. Soleus. Deep to gastrocnemius, it's one of the bigger but thin muscle. Together with the gastrocnemius and the soleus, it's help you plantar flex your foot. Basically, if you wear heels, right, tippy toeing is the function of those gastrocnemius and soleus muscles. All right, that's all I have for you for different muscles in our body. In the next video, we are going to look at how do these muscles contract and help us move.